Welcome and good morning. My name is Marianne Sabo, and I work with the Berrien County Health Department. Thank you for joining us today as we plan to debut the third video in our Play Your Part series as we work to spread awareness of the COVID-19 vaccine. We'll follow the video with a short panel discussion gathering some experts from our community. Before we begin, I'd like to say thank you to United Way of Southwest Michigan for its support of this community project. Let me start by introducing you to Tracy Burton, a well-known Southwest community resident and the executive producer and creative director behind our new video. Tracy, would you like to say a few words?
Yes, thank you, Marianne. I would also like to say thank you to the United Way of Southwest Michigan for their support and also the team that made this a huge success, and especially Tierra Allen, who was the cinematographer behind this visual. So thank you.
Thanks, Tracy. Now let's play the video.
One more thing before we leave. Keep Brother Bob in your prayers. Amen. Amen. You heard that he contracted COVID and is really struggling. Yes. So let us keep him in our prayers. Yes. Everyone here has to make a decision for yourselves, for your family, for your children. Yes. That we can make the right choice, even for our community. All right. And I encourage you to get your vaccine. Yes. I am happy to sit and talk with you. Okay. Whenever the time is necessary. I'm happy to do that.
I hear you, Pastor, but there are so many discrepancies. The vaccine isn't 100% effective.
You're right. That is true. However, high efficacy rate and ongoing research is 100% better than 0% effective. Yeah. Now, there are free vaccination clinics all over the city of Benton Harbor. There's one at Intercare, the Berrien County Health Department, some pharmacists, and some churches. Yeah. Congregation, let's do our part. Yeah. Let's do our part to protect our children and ourselves. Amen.
Hold on, it's gonna get better. You just keep on holding on, it's gonna get better.
Get that bag, get through.
Took me some time. Whoa. Took me some time, but I got it together. It's a cold, cold world, but I'm standing the weather. Watch some people change up when they get under pressure. It's gonna always get worse before it get better. No, before it get better. It's gonna always get worse before it get better. No, yeah. It's gonna always get worse before it get better. No, coming straight from Ben Harbor. I remember growing up without no father figure. Had to learn by myself, made me smarter. I don't show no love, my heart was bigger. Grandma told me, boy, you better stay up out of trouble. I don't know it all, but I learned from the struggle. If you give me one, I'ma turn it to a double. Coming from the bottom, gotta learn how to hustle. I'm a young king, put the crown on me. I know my granddad in the sky looking down on me. Yeah, looking down on me. I know my granddad in the sky. I'm a young king, put the crown on me. I know my granddad in the sky looking down on me. Yeah. Took me some time, but I got it together. It's a cold, cold world, but I'm standing the weather. Watch some people change up when they get under pressure. It's gonna always get worse before it get better. No, before it get better. It's gonna always get worse before it get better. No, it's gonna always get worse before it get better. No.
Just keep on holding on, it's gonna get better. Hold on, it's gonna get better. You just keep on holding on, it's gonna get better.
Wasn't that incredible? Such talent from our young rapper and vocalist, and such powerful messaging. Let's dive into that subject a little further. I'd like to introduce our panel for today. You've already met the video's executive producer and creative director, Tracy Burton. Now I want to introduce Chioma Ejiofor, the Special Projects Coordinator for the Berrien County Health Department. Chioma has worked a lot in the space of encouraging people to get the COVID-19 vaccine. I also want to introduce Betty Moore, a nurse practitioner from Spectrum Health Lakeland. And you'll recognize Diane Young from our video. We're delighted to have all of you joining us this morning. I'd like to start with a question to Diane. Diane, you shared in the video that you got vaccinated to protect our community. Can you explain that a little more?
Sure. Good morning, and thank you, Marianne, and to all of the partners that were part of this amazing platform. Thank you for allowing me to share my thoughts. I'm a very strong community advocate. I serve as a community influencer, and I'm the president of a group of 22 amazing women called Sisters from Another Mother. We are in the community a lot. We're familiar faces. People trust us and they listen to us. So in order for me, if I'm out trying to educate and influence others about the vaccine, I need to have received the vaccination myself. And so that's one of the main reasons is because of my community efforts. And so I knew, without a question, no questions asked, I had to get vaccinated. Another important reason is that for my job, I travel to Berrien, Cass, and Van Buren counties, working at work sites, working with employees to increase job retention rates. So with that being said, I knew it was a must. I had to do so in order to protect myself, my family, and my community. Thank you.
Thanks, Diane. Chioma, I suspect you've heard from a lot of people on the other side. They don't want to take the vaccine. What reasons are you hearing?
That's correct, Marianne. Some of the reasons we're hearing was the vaccine was created too quickly. There's some worry about long-term effects. If people who are vaccinated are still getting COVID, what's the point of the vaccine? Just some worry the vaccine can cause infertility or alter our genetic makeup.
Yeah, thanks, Chioma. Tracy, does this track with what you've been hearing in the community about why people are hesitant?
Absolutely. There is just a ton of fear, information overload, and definitely, I think in my generation, just social media and misinformation. So definitely echo what Chioma said.
Okay. Now, I want to turn to Betty. And Betty, I want to ask, why should people get the vaccine if it's not 100% effective?
Okay, so thank you for having me on the panel. So first of all, the COVID vaccine is very effective against preventing severe illness and death. But like all vaccines, it's not 100% effective. There's no vaccine that is 100% effective. However, when you get the vaccine, those who are fully vaccinated, if they do get the virus, if they do develop symptoms of COVID, it's generally mild and they don't have severe illness like those who are not vaccinated. So that's a big thing to remember, is that even though you may still get the virus, the effects will not be as severe a majority of the time. Just so that you know, last week, a little statistics here. Last week, across all of the Spectrum Health hospitals for all COVID-19 hospitalizations, 72% of those who were hospitalized, 77% of those who were in the ICU, and 80% of those who were on the ventilator were all unvaccinated. So these are big numbers that substantiate the fact that the vaccine does work to prevent at least severe illness and death. And then there's also the thought about, well, we keep hearing all these variants around. So now it's Omicron. And how is the vaccine, when it was made back when it was a different variant, how is that effective? Well, we have been studying that, and it does show that even though the vaccine may mutate and change, these vaccines are still effective at preventing severe illness. And that's what's key here.
Thanks, Betty. Those numbers are really sobering. So Diane, what are you hearing from friends or neighbors in the community who've chosen not to get the vaccine? What reasons have they shared?
Some of the same reasons that the other panelists have shared, Marianne. But for me, in the early stages of COVID-19, a lot of people were hesitant, very hesitant, because people that look like us, our history tells us that we were used as test subjects. Anything that was good was not really given to people that look like me up front. And so that was one of the main reasons. And then there's a lot of different lack of trust, lack of knowledge about the ingredients that are in the vaccinations. There were so many misconceptions being spreaded around in the community, religious beliefs, and some people easily share, why should I get vaccinated if I can still test positive for COVID? And then the information that was being shared, a lot of it was by people that they just really didn't trust. And so those are just a few more reasons why a lot of people have shared with me that they didn't want to.
Well, thanks, Diane. And those are some pretty compelling reasons why people have chosen not to get the vaccine. Tracy, how do you think your video and the Play Your Part campaign can address concerns over the COVID-19 vaccine?
My hope is really that the Play Your Part campaign has created space like the one that we're in right now to have honest conversations, to have real conversations with professionals. I hope that the healthcare system uses this as an opportunity to address the concerns that Ms. Diane just brought up. There is a real sense of a lack of trust within Black and Brown communities, not just within COVID-19 and the vaccine. So I hope this is just the beginning of like mending that trust, because for me, it did take individuals that looked like me, my grandparents and other people in the community that I trusted. I had to see them do it before I actually took that next step because I was hesitant. So ultimately for Play Your Part, I really just hope that it has created a space.
You know, that's so true and so insightful. Thank you, Tracy. So Chioma, I know the health department has done a lot of things to encourage people to get vaccinated and to get their kids vaccinated. How are you using social influencers to get the word out?
So at the start of the pandemic, we noticed a huge communication gap, meaning that our communities that were being hit hardest by COVID-19 simply were not getting our information. And this was due to things like lack of trust, also to lack of access. So the way that we're using social influencers is by putting our information into the hands of trusted community members. These community members will then take it to their respective spaces. And we've seen a lot of progress with this model.
Well, that sounds like a really great and very effective way to get the word out to the community. Betty, I know some people think the natural immunity they get from being sick with COVID-19 is better than the immunity they get from the vaccine itself. Why is that just not accurate?
There's several reasons why that's not accurate. Number one, when you get the vaccine itself, the immunity that you build up from getting the vaccine is far more predictable than what you will build up from getting the actual virus itself. So it's a more controlled response. Also, getting the virus itself, if you wait around to get the virus and get the natural immunity, that could be like a gamble because we can't tell who's going to get a mild case and then who's going to get a severe case. There's just, most of the time we say it's people with underlying conditions, but we've seen young people as young as 25 and 20 and even teenagers dying from getting this virus. And they didn't even have underlying conditions. So this virus is dangerous. So you don't want to play with that and just kind of leave that up to fate. And trying to do herd immunity, if you were to try to do that, a lot of people are going to die in that process. So nowadays we have the technology and the means to be able to come up with ways to protect our communities through vaccines like this. And so trying to wait for natural immunity is just not, it's just not feasible. Also, if you were to get the virus and then get vaccinated, your chances of getting COVID again have reduced a lot. Whereas if you get the virus, one study was showing, and then you don't vaccinate, you try and rely on natural immunity, you're twice as likely to get COVID again. So we are gathering data that does support getting the vaccine and not relying on just natural immunity. Plus, if you've already had the virus and you get the vaccine, you increase your chances of being protected against a second infection or at least a severe infection as well. Also, getting the vaccine is, like I said, it's just safer. If you get the virus, then you have to deal with some of these long-term effects that you're starting to hear now. They call them long hauler symptoms. And so people are having coughs or fevers or fatigue or brain fog even for weeks, months, even up to a year after being sick, whereas you wouldn't have that if you got the vaccine. So it's just safer, easier. It just makes more sense to get the vaccine.
Absolutely. And it's so helpful to get this kind of accurate information out to our community. So thank you, Betty. Diane, what's one message you'd like to share to encourage people to get the COVID-19 vaccine?
Excuse me. For me, thank you so much, Betty, for sharing all of that important information. I think it's definitely going to take a collective effort, a strong collaboration of community partners to continue to just educate the community and try to do our best to influence them to get vaccinated. I mean, everybody, the churches, faith-based organizations, workforce development, employers, health agencies, in the community as a whole, and simply what I call the village. It's going to take all of us to work, to continue working together and just helping people to understand, clearing up any false information or misconceptions, making people feel safe and comfortable in wanting to do so and to move forward. And I want to share a little bit about what Betty said earlier. I can attest to that. If you do get COVID-19 after being vaccinated, it's less severe. The symptoms are mild. I have a family member that I can share personally that did test positive for COVID-19 twice. The first time was prior to her being vaccinated. 3 weeks of severe illness. Thank God, no hospitalizations. But that second time around, she tested positive. She had already received both vaccines, mild symptoms, just light headaches, dizziness, and some tiredness. And I know we knew that if it had not have been for her being vaccinated, it would have been way more severe. So that second time around was way less, did not experience too much of anything. And her words were, the second time around, it was a piece of cake. That's coming from someone that tested positive twice. First time, very severe. Second time, piece of cake. Very important. Get vaccinated. Thank you.
Oh, thanks, Diane. And thanks for sharing that very personal story. I think those stories are really powerful, and sharing them can be really helpful in encouraging other people to get out there and get the vaccine. So Tracy, same question to you. What's one message you'd like to share to encourage people to get the vaccine?
I would just like to reiterate that it is a very personal decision. As I shared earlier, I was extremely hesitant. I was nervous, and then I did ultimately decide to become vaccinated. I would also like our community to think about life outside of this pandemic. It has been a harsh couple of years, but there is hope beyond this. You can reach out to any of us on this panel, get the accurate information. And again, it is okay to be scared, but there is hope beyond this pandemic.
Thanks, Tracy. And with all of the messaging that we've had, it is good to remember that there is hope out there. So Chioma, we've been talking a lot about community concerns over the vaccine. What are some things public health agencies can keep in mind as they think through future messaging to promote the COVID-19 vaccine?
I think there was a quote that Tracy made in the video that says that we have to make a space for hesitancy. And I think as public health agencies that we need to really embody that and not look at hesitancy as something that we have to solve, but create space for it. As public health agencies, that we're coming from a place of extreme privilege. Oftentimes we get data or information before the public does. So it's easy for us to see messages about vaccines and like, yes, that's the right thing to do, but the community often doesn't have that. And that's often where the hesitancy comes from. Through the panel, we've talked about some just historical things that have happened that have also created hesitancy. And I think as public health agencies, the way we create space for hesitancy is by being empathetic, by being understanding and knowing that these concerns that our community has, they're not conspiracy theories, they're coming from a place of fear and often could be legit. And we just need to take the time like we're doing today to talk through it, to listen and lead from empathy.
Yeah, thanks, Chioma. I think the empathy is always a good starting point. So Betty, last question for you. What advice do you have for someone who's concerned about the safety of the vaccine or thinks the ingredients in COVID-19 vaccines are dangerous?
Well, first of all, we need to remember that the FDA really looks into the production of these vaccines, how safe they are, what goes into them, and they're not going to approve anything that doesn't show that it benefits the patient and that it doesn't, and if it doesn't meet their safety criteria and guidelines, it will not be approved. And so, you know, we can take comfort in knowing that the FDA has some really stringent rules and regulations out there on how these things are made. So knowing that, we should be able to help people to feel a little bit more comfortable about that. Also, there's been some question about, you know, what's in the vaccine, or what people have been hearing all kinds of things. And I'm here to tell you that there's no strange ingredients in the vaccine. There's no fetal aborted tissue in the vaccine. There's no secret medication or latex or preservatives or antibiotics or anything else that people may be hearing out there from others. This is a safe vaccine made under safe rules, safe guidelines. Also, just to know about how the vaccine works, basically what it does is it provides your body with a kind of like a map or a guide on how to recognize the virus when it comes across it, and how to build up your immune system. Your immune system is like your army. And so once you give that army that map, then that army can recognize the enemy and then fight the enemy. Okay. And so that's how that vaccine works. Once that vaccine has done its job, then your body kind of just gets rid of it. It doesn't stay in your system long term, just like any kind of cell or any other things that are in your system. When their time is finished, your body does a natural process and cleans it out. So what's left is the blueprint or the map that it gave you to fight the virus.
Oh, thanks, Betty. That's really helpful information. And I know I've learned a lot already today. I want to again thank our wonderful panel for this great information and for this really candid conversation. We appreciate everyone for tuning in. And I want to let you know that you can get more information on the COVID-19 vaccine on the Health Department's website, which is www.bchdmi.org. So thank you again.